If you have mild diabetes, sometimes it can be controlled with diet and exercise alone, but most people will end up needing either pills or injected insulin. Whether a patient requires insulin really depends on their blood sugar and whether it can be controlled on oral medication. Many patients end up doing a combination of both. All patients will need to monitor their blood sugar at home and keep a journal of how their blood sugar changes over time. They also need to eat a healthy diet and, of course, limit sweets. A recent analysis found that about 13% of adults had type 2 diabetes and another 30% had prediabetes, which means they're at risk of developing diabetes in the next 10 years. There's no cure for type 2 diabetes, but you can manage it and in some cases prevent it. First and foremost with a healthy diet and exercise and maintaining a healthy weight. In fact, if you're overweight and you drop your weight by 5 to 10%, you can reduce your risk of type 2 diabetes by half. You want to focus on fruits and vegetables, which can reduce your risk by as much as 22%. And of course, cut out those sugary drinks. A study found that Black women who drink more than 2 or more sweet drinks a day have a 25 to 30% higher risk of developing type 2 diabetes. You want to get moving because just 30 minutes of exercise a day can cut your risk. And limit how much television you watch. People who watch more than 20 hours a week have more diabetes than people who watch only 10 hours a week, probably because they're not physically active.